What's up, everybody? So I wanted to come on and do a video about cardio. I'm in the car. I'm still buckled up for safety because it's important. I know if I don't do this video while I'm thinking about it, I won't. So here we are. So I talked about plyos the other day in a post or in a story. Plyos are not, first of all, the plyos that people do in bodybuilding are not true plyometric training. So plyometric training is for sports, explosion, speed, that sort of thing. It's really just about using your tendons and things to explode, and that's not what we need in bodybuilding, no matter what division you're in. So the plyos that you do for sports and the plyos that are prescribed by some coaches in bikini or whatever division are completely different. But as far as actual benefits and what type of cardio you should be doing, there's some data out there to support how many calories you burn, post oxygen consumption, that kind of thing from HIIT training. And that's that's not necessarily a bad thing if you're a lifestyle client or just a person who's not a competitor. There's nothing wrong with doing some HIIT training. It's a good way to get the heart rate up, good way to release some endorphins, feel good about something, stay athletic, stay mobile, that kind of thing. That's fine. Now if you're a bodybuilder, the main goal of bodybuilding is to you build muscle, retain it, and then get as lean as possible. All right, so if you want to retain muscle, you don't need to be using that muscle, taxing your nervous system on high intensity cardio. So that's where your low intensity and your moderate intensity steady state comes in. The first thing that I would do, so first of all, if you're an enhanced athlete of some sort, or a bigger person, muscularly, you probably need some cardio just for general heart health. 3 times a week, 20 to 30 minutes, just as a baseline, right? So if you're in off-season push phases, it also helps keep appetite up, that sort of thing. So it's definitely important to keep some cardio in, and you probably should be doing some anyway, especially if you're a bigger bodybuilder. Now, somebody with a really fast metabolism, somebody who does bikini, or somebody that's a smaller human in general, and they don't have issues with not on anabolics and things like that, then maybe the cardio doesn't have to be kept in all year. But it's still probably not a bad idea. Keep blood flow, recovery, that sort of thing. And also it's a nice way to start your day sometimes, or clear your head and that kind of thing. But what you should be, the first thing that I would do, beyond just your baseline cardio of however many times a week, I would do a step count. And what I'll do normally with my brand new clients, I don't give them a step count immediately. It's kind of like a diet. You don't want to give somebody a certain diet without kind of knowing what they're taking in already, and what their metabolism is capable of handling and that sort of thing. Just like with a step count, I'm not going to give somebody who moves, my base step count, if I don't do anything for it, is like 1,500 steps or 2,000 steps, because I work from home. The only place I go is the gym, typically, and so I'm not getting a ton of steps daily. So I wouldn't just throw myself 10,000 steps, but I would probably start with like 5,000 or 8,000, or whatever. And so you get the baseline of the person, figure out how many steps they're normally taking a day, and then you create a baseline, slightly above that, or just make sure the days are consistent so that you're getting a few more steps weekly total, that kind of thing. So that is where I would start. I would start with a step count, because there's very minimal recovery required from just getting some steps in. So I would start with step counts, and then you can put in some intentional cardio, or that's what I would do, as a coach or an athlete. So you put in some low intensity steady state. I like to do, like I said, usually around 3 times a week as a baseline. I'll move to 4 or 5 times a week, and then I'll start increasing the time. Maybe I'll go to a 6th day, and then I'll just increase the time on all of it, as we're stair stepping toward the show, as we need to increase calorie burn, as our bodies adapt, as we lose weight, as our metabolisms slow down to adapt to the lower intake and the lighter body weight, then you might need to do a little bit more cardio. And so I'll add up to where it's 6 days, X number of minutes per day. I know there are some people out there that do the calorie thing. I think that's fine. The only problem I have with that is if you use a different machine, then it's not going to be accurate, and maybe one day you feel really good, so you bust out 10 minutes, you burn your X number of calories, and then one day you're dragging along, and then you're spending 20-30 minutes in there, and it's just not, in my opinion, it's not, I don't like managing it that way, because it creates some variety that I'm not trying to have, right? Like I said, I don't think that's a bad way to do it. It's just not how I like to do it. So I'll increase, the days, or the days to a certain extent, and then I'll add minutes to each day, and then eventually it gets to whatever it needs to be, right? Low intensity, steady state. I mean, you're looking, moderate intensity, you're looking heart rate anywhere 120, 150. Lower intensity could be closer to 120. Depends on the person, depends on the level of effort. It doesn't necessarily matter if you call it LISS or miss. It's really more about the recovery. The key to cardio is doing what you can recover from, and still get the calories burned, still get your heart rate where you want it. That's the important thing with cardio. That's why I love uphill walking. I love biking. I use the elliptical a lot. Some people don't like it. I enjoy the elliptical. I find that it's very easy to get my heart rate up on the elliptical, and it doesn't seem to tax my joints or my nervous system very hard. I don't have trouble with muscle recovery with it. I typically don't recommend any of my clients do stairs. If you've got huge legs and you can afford to lose some size in your legs, and maybe you need to, steps are probably fine, because it will hinder recovery from your leg training, or it'll keep you from actually being able to train quite as hard on leg days because you are fatigued in your lower body. So it all depends on the person and the client, and all those kinds of factors. But yeah, so that's pretty much it. I'll start out with a certain level, slowly increase it as needed. But I don't hardly ever prescribe HIIT. I don't ever prescribe, sprints. It's just not something that I think is a good idea, most of the time. One other thing that I did want to mention, the timing of cardio. Now, fasted cardio really isn't more beneficial for anyone, unless you happen to wake up in the middle of the night and take GH, and then 3 hours later or so you're doing cardio when it would have peaked. But if you wake up in the morning, do take your GH and go right to do cardio, it's not really benefiting you. It's not in your system that quickly. That used to be the school of thought, and I do love that philosophy, but it just doesn't play out in reality the way that we would like for it to. Having said that, I don't think there's anything wrong with fasted cardio. I enjoy doing my cardio fasted. I like to save food for later, especially around training. I like to start my day with cardio. I like to get things done, before whatever work I have for the day and that kind of thing. So I don't have a problem with fasted cardio. I think it's great if it's, if you prefer that. I don't love post-workout cardio for most people. Now, again, if you have certain body parts that you don't need to grow, or that are ahead or whatever, then I think that's fine. I've been doing some upper body post-workout cardio lately, just because my legs are my weakness, and that's what I need to grow. So, to catch up with my upper body. And so I don't mind if I grow a little less in my upper body, or if I, if I'm, turning on AMPK post-workout with cardio in my upper body sessions, because I'm not super worried about getting my upper body any bigger. So those are all factors to consider, for each and every person. The biggest thing is picking cardio that you'll do, or the time of day that you'll do. Especially if you're not a competitor, you don't have really specific physique goals, you can kind of do it whenever. I wouldn't recommend doing it right before training, because you will use up some of the energy that you have stored for training. It could take away some of that. Your nervous system, you're going to train it to move really slowly, and then you try to get in the weight room and start moving weights quickly and activate the fast twitch fibers. It might not, you might not be in a great place to shift gears like that, to go from slow cardio to really fast lifting weights. So for those reasons, I don't think pre-workout cardio is great. I don't mind a 10-minute warm-up or something, but I definitely don't like a whole session right before lifting weights. If possible, you want to separate cardio from training, by several hours, just so that you can keep all of the metabolic signaling separate, and really take advantage of the weight training sessions and the recovery from that. And then, use the cardio at different times for fat burning and fat loss and cardiac health. So that's pretty much what I wanted to talk about with the cardio thing. It's a lot of different ways to do it. Ultimately, the goal is calorie burn, muscle retention. So talk with your coach. If they give certain recommendations, run with them. Not literally, again, running is not something that I recommend for athletes that are competitors either. Again, back to the legs, to finish that pun there. But yeah, so talk to your coach, figure out what works best for you and what makes the most sense for your goals and your situation in life, and let's all get shredded.